Good afternoon. Welcome to the WHO press conference following the fourth meeting of the Emergency Committee on Zika virus and observed increase in neurological disorders and neonatal malformations. My name is Marcia Vanderford. I'm the Director of Communications at WHO. Today, our spokespersons are the Chairman of the Emergency Committee, Dr. David Heyman. Dr. Heyman is Professor of Infectious Disease Epidemiology at the London School of Hygiene and Tropical Medicine, and Dr. Pete Salama, the Executive Director of WHO's Health Emergency Program. We will start the press conference with statements by Dr. Salama and then Professor Heyman. Following their statements, I will open the floor and the phone lines for questions. Journalists on the phone can signal that they have a question at any time during the opening statements or after that by dialing 01. We don't anticipate having technical problems, but in case we have problems hearing questions by phone, you may submit questions to tvstudio@who.int. Since we also have some viewers on Facebook, we welcome those followers to type in questions in the comments section below the screen. Now it is my pleasure to recognize Dr. Pete Salama.
Thank you so much, Marcia. Good afternoon. Welcome to this press conference following the fourth meeting of the Emergency Committee on Zika and complications which took place yesterday. I'll give you a brief background on the committee, WHO's Zika response, and then hand over to the committee's chairman, Dr. David Heyman, for the outcomes of the meeting. The Emergency Committee, as you'll be aware, is a mechanism under the international health regulations that provides WHO with technical advice in the context of a public health emergency of international concern. The committee provides views on whether the event constitutes, or in this case, still constitutes, a public health emergency of international concern. It also makes recommendations on the measures that should be put in place to prevent or reduce the international spread of disease while avoiding unnecessary interference with trade or travel. The committee's members are drawn from a roster of international experts in fields such as disease control, virology, vaccine development, and infectious diseases. As you remember, on the 1st of February this year, the committee advised WHO's Director General that the cluster of microcephaly and other neurological disorders reported in Brazil constituted an extraordinary event, a public health threat to other parts of the world, which required a coordinated international response. In effect, it met all of the criteria for what we call a public health emergency of international concern. The Director General followed the advice of the committee and declared these consequences of Zika a public health emergency. Since then, WHO and other partners, particularly those working in the affected countries, have worked together in a coordinated, multifaceted, and international response. We've supported this in-country work with guidance on how to control mosquitoes that spread Zika, how people can protect themselves from bites and the sexual transmission of Zika, how health workers can advise women worried about Zika on the risks and the choices at their disposal to manage pregnancy, how health workers can monitor and manage infants born with microcephaly and other complications. We've also provided training and technical experts to support the response that affected countries have mounted. Working with the scientific community, we've learned that Zika has consequences in infants beyond microcephaly to a range of complications, from hearing and eyesight complications to seizures, and we now have called this the Zika congenital syndrome. Many entities, both public and private, are working on the development of diagnostic tests and vaccines, and WHO is helping to coordinate this work through the Research and Development Blueprint. Yesterday, the WHO Secretariat briefed the Emergency Committee on the epidemiological situation and updated on the activities that have taken place following the temporary recommendations the committee made at its third meeting on June the 14th. Brazil, Singapore, and the United States of America presented their situation and their response. I'm now pleased to give the floor to Professor David Heyman, Chair of the Zika Emergency Committee, who will brief you in detail on the results of yesterday's deliberations. Thank you.
Thanks very much, Peter. As Peter said, this was the fourth meeting of the Emergency Committee, and you'll remember at the last meeting that there was a change, a nuanced change, but an important change, in that there was enough evidence to say that this Emergency Committee has decided that the public health emergency of international concern includes Zika, that Zika virus is the public health emergency of international concern because it's been shown that it is now clearly associated with microcephaly and other abnormalities. At the committee meeting yesterday, there was an overview of the current epidemiological situation of Zika first of all, in an overview given by the WHO Secretariat with information very similar to what you've heard from Peter today. And in addition, there were reports from governments from Brazil, from Singapore, and from the United States. Brazil reported, first off, that in fact, during the Olympics, and since the Olympics have been over, and as they're preparing for the Paralympics, there have been no athletes or any participants who have come to their attention with sickness that is Zika infection. At the same time, they also described to us the studies that they're doing in Brazil and the concerns that they still have about one area of Brazil where there's an increase in the number of microcephaly cases reported as compared to other areas. And they're continuing intensive study in those areas. In Singapore, they reported very transparently the current situation, which is very early, as you know, it's a week old. And they reported the number of cases they've found, and they also told what measures they're taking, especially the intensified measures on vector control in Singapore. And in the United States, they talked about the vector control activities going on in the U.S., as well as what they've been finding and where they've identified the virus as currently circulating, and they reviewed some of the recommendations they've made to their populations as well. Based on the deliberation that followed after these presentations, and this was in the presence of 5 or 6, maybe even 7, international experts in viral disease and mass gatherings, because those experts were also available to the committee. These deliberations decided that the situation continues to constitute a public health emergency of international concern. And this is because new outbreaks of Zika continue to be identified in new geographic regions. For example, there was an outbreak identified in Guinea-Bissau and another in Singapore, as you know. So these were the deliberations. The deliberations led to this conclusion, and it led to, in fact, some new recommendations. There were many recommendations in the past on research issues and vector control issues that continue to be enforced and should be re-emphasized. But in particular, there are knowledge gaps that remain in the full scope of the disease. In other words, its natural history. What does infection do? What are all the side effects and all the effects that occur from infection in a fetus and also infection in adults? As you know, there's some new information that shows that there are some impacts of the virus on brain cells, and it's not clear what that might mean. This is laboratory tests, what that might mean in the humans. At the same time, the committee wanted to make sure that there's increased research on sexual transmission and also how long the risk is for sexual transmission of the Zika virus. So studies that were requested to be intensified in those areas, and also, as I said earlier, in intensifying to look and see if there might be some cofactors, a chemical factor in the environment or another infection, which might be in some geographic areas causing an increase in the numbers of microcephalic cases. At the same time, the evolution of the Zika virus is very important also to be known, and the committee felt that more information needed to be known on the two lineages. You'll remember there's an African lineage, African strain, and an Asian strain. And so far, the only strain that's really been linked with microcephaly is the Asian strain, but the African strain has been occurring in outbreaks for many years, and nobody ever really looked. And so, the question is the African strain also causing microcephaly? And there's some information coming that may be useful in making that analysis. And finally, the question of whether infection with Zika virus in one area, for example, in Africa, with the African strain, would provide protection against the Asian strain or another strain. And also the same question about related viruses such as chikungunya and dengue. And so the committee, I guess, felt that, I'm sure, in fact, felt that though we know much more about Zika after the first 7 months, there's still an urgent need to continue sustained and global research, and this still does remain an emergency of international concern. But there was much discussion in the committee and actually with the Director General and with Peter about the fact that this extraordinary event is rapidly becoming, unfortunately, an ordinary event, and that Zika is beginning to spread or continuing to cause outbreaks in many countries around the world. And so the committee also recommended that WHO prepare for the next committee meeting, which will be in 3 months or less, but probably within the next 3-month period, to prepare how WHO would be able to coordinate within WHO the various groups that are doing such important research on vaccines, on diagnostics, getting together the experts in the world, and also those that are providing technical assistance to countries, and also those that are developing the guidelines. One final issue that was very important to the committee was the developing countries, or those lower resource countries. Because though it's been found in Singapore, because they have an extensive, a very highly technical health system, very technologically advanced health system, they've been able to identify it very early. But in other countries where it might enter at some time, that might be the case. And so there was much discussion among the committee and with the Secretariat about being sure that there was special emphasis put on appropriate guidelines and appropriate guidance and technical support to the lower resourced countries as Zika continues to occur in more and more geographic areas. So that was the summary of the committee. And I think the committee, we've been in touch this morning, and the committee is very pleased that the Director General has actually accepted all of the recommendations that were made by the committee. Thank you.
Thank you, Dr. Salama. Thank you, Professor Heyman. As we open the floor to questions and the phone as well, please remember to dial 01 in order to join the queue to be recognized. We're going to take 2 questions at a time. We'll start first with journalists here in the room, and then we will go to the floor. Are there questions here, please, to begin? Yes, Marta from EFE. And go ahead, please.
Marta Hurtado, Spanish News Agency. I want to ask to Dr. Heyman if you can elaborate on what you said, the relation about immunity from one strain to the other and the relation with chikungunya and dengue fever. Thank you.
Thank you. And another question from the room, please. We don't have another from the room, but I know that Helen Branswell from STAT is on the phone. So Helen, if you can ask your question, please.
Thank you for taking my question. Dr. Heyman, could you please elaborate on what the comment you made about looking for cofactors? In the past, when WHO has been asked about this, the response was that it didn't seem like there was a cofactor involved. What are you thinking about? Is it trying to figure out why Brazil's numbers are so much higher than everyone else's?
Okay, thanks for these questions. I'll start to answer them, but I think Peter will certainly be able to complement what I say. The relationship of immunity, or the question of immunity, I think it's best described by telling you that back when smallpox still existed, there was a vaccine that protected against smallpox infection. That vaccine was a vaccinia virus. It had nothing to do with the smallpox virus. It was a related virus, an orthopox virus. And that virus created immunity not only to vaccinia, which was what was in the vaccine, but also to smallpox. So that's what we're talking about. Does infection with the African strain, for example, protect people from infection with the Asian strain? So that's the question that's being asked, one of the questions. The other is there a need to really look at the immune response in these two different, this is basic research, this is long-term research. Is there a need to look at these two viruses, if indeed they are causing different effects? In other words, if it's only one that's causing microcephaly and other neurological deficits, is it necessary to look at both of these viruses to see why one is different from the other? So those were some of the questions that were asked, and those are the questions that are under research, and certainly WHO will be trying to make sure that that research is going on. The second issue on a cofactor, I'll answer briefly, and then I'll turn over to Peter. I think that WHO, I've not followed closely what WHO has said, but every time we've had an expert committee meeting, there's been a discussion about the possibility of cofactors, and the fact that though it doesn't look like there is, there needs to be full and complete research, including the case control studies, that can eventually identify whether or not there is a cofactor. And this is particularly because of the difference in the manifestations in different countries.
Thanks. Just to add, David, and in relationship to the question on immunity, this is actually a real-life question now, because in Guinea-Bissau we have confirmation that the cases of Zika are due to the African lineage. So the question becomes, does the African lineage cause the same kinds of neurological complications, whether it's microcephaly or Guillain-Barré syndrome, as what we've documented with the Asian lineage? So it's an outstanding question, and indeed in a place like Guinea-Bissau, as I said, a real-life question, because there are cases of microcephaly in Guinea-Bissau, and now the work is ongoing to see are they linked epidemiologically and through lab confirmation with the cases of Zika. So it's a real-life question for Guinea-Bissau today with real-life implications. In terms of the issue of cofactors, it is an outstanding question, there's no doubt. And in the scientific community, there's still a lot of work, including case control studies going on in Brazil, particularly in the northeast, to help try and explain the variability in the incidence of complications. So there is certainly huge variability, and we have to answer the question, is that simply because the virus has gone through the population at a different time, so there's just a time lag and we're just waiting for the complications to catch up with the infection, or is it truly because there are other factors at play that make one part of the world more likely to result in complications than another? So that is an outstanding question. It was discussed yesterday by the committee, and I know the government and partners in Brazil are looking into those issues as we speak.
Thank you. I'd like to recognize Maria Wenzel on the phone, please.
Yes, hello. I'm Marina Wenzel. I'm a freelance correspondent with the BBC World Service, BBC Brazil. You just mentioned that an extraordinary situation is quickly becoming ordinary. And now the live question is how much other cofactors could be involved in the microcephaly complications that we've seen so far, only strongly happening in Brazil. Have we been too overcautious in the months before the Olympics when we raised this flag of the Zika too high, and then could that eventually have had an impact on the low show-up and turnouts that we have seen in the arenas?
Thank you. We'll take another question before response. May I recognize Lisa Sneering from CIDRAP News, please?
Hi, thanks for being available today. I had another question about the lineages. Is there any information yet about the one that's involved in the Singapore outbreak? And also, a confusion I have is, are you still talking two lineages? Sometimes in the research reports, they seem to single out the Americas strain from the Asian strain. So Just was wondering if you could clarify that. Thank you much.
Okay, Pete.
I'll take the first question on the Olympics. So certainly I don't think the government of Brazil or WHO or the emergency committee was over-cautious in relationship to the Olympics. This was and still is a new manifestation of an old disease, and we're still learning an enormous amount about that. And as we've discussed in the previous questions, there's still a lot of outstanding research issues and an outstanding research agenda to give us a fuller understanding. So I think because of that, we are right to be cautious. And let's remember that the risk assessment officially from the Emergency Committee and WHO was very much that there would be a low risk of amplification of Zika by the Olympics, not a significant risk, which is what the risk assessment had outlined. And I think so far the data to date, at least, has really validated that assessment, that the risk is low. In fact, we don't have any confirmed cases of Zika amongst travellers or amongst, indeed, the athletes. And while we're still entering now the phase of the Paralympics, which start, as you may know, on September the 7th, we are optimistic that the same risk assessment will hold and there will be little additional risk posed by the Olympics, given the fact that we're still very much in the low season for transmission of vector-borne diseases, particularly those transmitted by this particular mosquito vector. So I think it was right to be cautious. I think the low-risk assessment has withstood the test of time.
As far as the Asian strain was first identified in the Pacific Islands in 2007, and this is the same strain that's gone into Brazil and into the Americas. And this is the strain that has been associated so far with microcephaly and other neurological disorders. The question about Singapore, when we asked Singapore government yesterday about the genetic sequences, which is what will tell you which virus this is, they have not yet been able to complete all the work. This is very recently identified. And so they anticipate that they will have the information later this week, or this weekend, or early next week. So I think that the work is going on in Singapore. They're sequencing the strain, and then they're getting the normal comparison that you have of this strain with other known strains to make sure before they make an announcement that they know what they really have.
Maybe just to add that the way the government of Singapore has handled the outbreak in Singapore really represents, in many cases, a role model. 115 cases have been confirmed, remembering that the first case was only confirmed really just a little over a week ago. So within that period of time, there's been enormous amount of epidemiological work, of lab work, of public health work, including vector control, detailed follow-up, including retrospective analysis of cases in Singapore. And really, we have to congratulate the transparency and the quick reporting that the government of Singapore has implemented in the case of this outbreak, and hope that all other countries can do the same. And I think we can also say that the government of Brazil has followed a very similar model and very successfully giving us quick and comprehensive reporting.
Thank you. Let me call on Christian Vogel from Finance Magazine, please.
I think you may mean Gretchen Vogel from Science Magazine.
Please go ahead. We may not have meant that, but you have the floor.
Okay, good. This is Gretchen Vogel from Science Magazine. Are there any data that are getting us closer to understanding what the real risk is to pregnant women? There was hope this spring that studies in Colombia would help figure that out, but so far as I can tell, that hasn't been the case. Is it 1% of affected pregnancies, as the early data from French Polynesia suggested, or is it closer to 30%, as the early results from the Rio cohort suggested? Less than 1%, given the relatively small numbers affected babies in Colombia? Seems to be a really important question for which there just aren't very good data.
One more before response. Lisa Schlein from Voice of America, please.
Yeah, thank you. Hi. I'd like to ask you specifically about the situation in the United States. It appears that Zika is now rooted in Florida, and concern is mounting throughout the country that there might be a wide spread of the virus throughout the country. I'd like to know if you share this concern, whether it is warranted, what measures need to be taken in order to get quick control over the disease, and also when Ebola was a huge problem in Western Africa, and there was concern in the United States was kind of slow off the mark in approving money for that disease, and the same thing that seems to be happening in Zika, where the Congress is a little bit slow off the mark in approving the amount of money asked by the CDC in order to get a handle on Zika. I'm wondering whether you think this is a mistake, whether money is really needed.
Thank you. Before we respond, just a reminder, if you'd like to ask a question, please dial 01. So 2 questions, one on the risk to women and one on the status in the U.S.
David and I didn't hear the first part of the second question. It was in relationship to Colombia. Is that correct? Could we just confirm?
Yeah. Could we have?
No, are you asking about my question, Lisa Schlein? I said that the Zika virus appears to be rooted now in Florida, in the United States. And I'm wondering, there's great concern about the disease spreading in the United States. I'm wondering whether you share this concern, what measures need to be taken to gain control over it, and whether money, which has been slow in coming, is necessary in order to gain control over the disease. And then, since you called me back, I have a question I failed to ask, and that has to do with Africa. If you could then follow up with an answer regarding the situation in Africa and whether you have concerns about Zika there, or whether, since it has been in Africa in previous years, whether there's a certain immunity which exists in the continent.
Great. I'll start and ask David to continue. So on the first question on the risk to pregnant women, we don't have a definitive answer today. We do believe the risk is relatively low, but it's significant. And the risk is particularly in the first trimester that we're most concerned about. As well as that, we are, as we referenced in the earlier response, really waiting for the data on issues around cofactors and on ensuring that we have enough data points from enough countries that have relatively mature epidemics so that the numbers that we can quote over time are stable. So really it's still an outstanding question, but we can say conclusively there is a risk. The risk is relatively low but significant, and it's particularly in the first trimester. In terms of the second question on Florida and the US, yes, there are certainly concerns, as have been expressed by CDC, on 2 particular communities within Florida that have seen a fairly large number of cases in a short period of time. There has been money to CDC and through CDC to the state health departments that has been distributed, and that's allowed the public health community to respond, particularly on enhanced surveillance and on vector control. There's more to be done in all of those areas, and I know that our colleagues at CDC, led by Tom Frieden, are really leading the charge, and of course additional resources I'm sure would be helpful. In terms of further spread, yes, a risk. As we said, and the US is no exception, wherever there is a competent vector, in this case particularly Aedes aegypti, there is a risk that the virus will spread. On the question about Africa, as you know, we now have confirmed cases in 2 African countries, in Cabo Verde, where we have cases from the Asian lineage, and in Guinea-Bissau, where we have now confirmed cases from the African lineage. As we referenced earlier, for the African lineage, we still need to confirm the relationship between microcephaly, and we are also have an outstanding research question around the levels of baseline population immunity and the cross immunity with other lineages. So there's still outstanding questions. I think, though, the bottom line message for Africa and for other parts of the world where health system capacity may be lower than where we've seen Zika, particularly in the Americas, is to ensure the preparedness is in place to deal with the complex set of complications that may occur as a result of Zika virus infection. And that's something that WHO and partners are really wanting to work with the African countries and other countries where we have low health system capacity for preparedness. David?
Yeah, I would just maybe, Peter's covered the topic very well. I would just say that often in the committee discussions, when we're looking at the risk of microcephaly and other neurological disorders in the fetus, we're comparing this to what happened with rubella before the 1960s, before a vaccine. Rubella, as you know, is German measles. And with German measles, if a mother in the first trimester, or a pregnant woman in the first trimester was infected, it was 85 to 90% sure that that child, when born, would have some type of a defect. And that's why it's so important to be looking for defects other than just microcephaly in children who are born now. That's why one of the recommendations was to intensify research on the natural history, what's called the natural history of infection. But still, even with what data we have today, the risk, as Peter said, is very, very low. And that's fortunate, but it's still a very important disease, especially if it's your family that's involved. And until there's a vaccine, we won't have an effective means of preventing infection.
Thank you. Our next two questions will be from the phone. The first one from Jamil Chade at St. Paulo. Please go ahead.
Yes, hello. My question is about, of course, the situation in Brazil, and especially the issue of funding. Brazil is going through a crisis, and it is known that many of the services have been cut, especially in the, let's say, social sectors. How much of that is a concern to you? Have you received any assurances today by the Brazilian delegation that, or the participants from Brazil, that actually there will not be any cuts in funds, and how do you see this going forward? Thank you.
And the second question then from Sabrina Tabranisi from the New York Times.
Hi, thanks for taking our questions. On the Brazil Olympics question, just kind of curious, how would you guys know, or how would Brazil know if there were no cases? I mean, most of the cases are asymptomatic. Is it just that kind of it, you know, it's sort of a guess that we think there are no cases, or I mean, how certain are they that that's actually the case?
I'll speak to Brazil. What the Brazilians told us about their program of surveillance and looking for the disease among people who were sick during the Olympics. They gave us the figures, the number of people who presented to health facilities who were either Olympians themselves or who were spectators at the Olympics. And they gave us very convincing data that showed how many people attended for illness and how many of those people had Zika, and there were no people who had either any evidence of an acute Zika infection. And it's right to say that the asymptomatic cases would not be picked up during the Olympics, but there will be certainly some cases that are symptomatic, despite the fact that 80% are asymptomatic, and they were not found, nor have they been reported in people who have returned back to their own countries. They haven't been reported to WHO, and WHO has a surveillance network which is looking for that. Peter.
Yeah, no, I think you're quite right in suggesting that the majority of cases, indeed, we think up to 80% are asymptomatic. But as David has outlined, in the context of enhanced and active surveillance in Brazil, the fact that many people have been tested, there's been no confirmed cases, and indeed that through WHO's work under the international health regulations and the notification of all the IHR focal points around the world, we also have not heard back from any of them that even the delegations going home are reporting symptoms or confirmed cases. So that gives us a fair degree of confidence that certainly there's been no large-scale transmission. Now, of course, you're right. There may be a few cases that come up either now or after the Paralympics, but certainly we feel fairly confident that the risk assessment that there'd be no significant increased transmission due to the Olympics is fairly much on track. On the first question, I haven't been in direct contact. I've only arrived recently myself with the Brazilian delegation, but they did brief us yesterday at the emergency committee, and certainly it does appear that the response in all facets to date has been robust, whether it's the preventative side and the vector control and management, or the clinical care side and follow-up of pregnant women and women with complications has been robust, but I'm not in a position to give you further details today.
Thank you. We'll take a question from Facebook now. Gillian Morrison is asking, are we expecting Zika to be seasonal or will it remain constant? And our second question then from the phone, Swedish Radio, Johan Bergendorf. Please go ahead.
Yes, hi. Thank you for taking my question. I wonder about the study of the Fiocruz researchers showing that it could be another vector also, except for Aedes aegypti, and a Culex quinquefasciatus vector. And I wonder about your reactions to that study and if you think that the vector control should be done in another way to meet that vector as well.
So on the two questions, the answer to the first question is yes, with a caveat. Certainly, it will be seasonal in the sense that we expect that the cases will follow the seasonality of the vector density, and particularly Aedes aegypti in this case. So that's one of the reasons why, of course, we didn't expect a very high transmission during the Olympics and Paralympics, because they're the winter months in Brazil. Now, of course, in the other parts of the world where we have summer, we can expect an increase in the summer months. Having said that, it's not impossible to have transmission during the winter months. We just expect that it will be at the lower level. On the second question on Culex, you're quite right that Zika virus has been isolated from other mosquito species, but the question remains outstanding as to whether other mosquito species beyond Aedes aegypti and albopictus can really transmit the virus, and that remains an outstanding research question.
Professor Heyman, anything to add? Okay. Then we will go to follow-up questions, one from the room and then one from the phone. So Marta from EFE, please go ahead.
Yes, and then Jamie. What about the case of Colombia? We've been waiting for many months to woman to deliver, and it was about the end of June, July. Now we are in September. Do you have any results, any increased cases of microcephaly on other neurological disorders? Because it was a standing question there for months. Thank you.
And then our follow-up question from the phone is from Gretchen Vogel from Science Magazine.
Thanks. Yeah, unfortunately, one of the only tools available to fight Zika is vector control, but the evidence that vector control, at least spraying, has any effect on dengue transmission and other mosquito-transmitted diseases is fairly thin. I wondered if there are studies going on to try to get a better idea of which vector control methods, if any, are having an impact on Zika transmission rates.
Okay.
I'd just say a word on vector control. Vector control is not the only tool we have. In fact, the most important tool is understanding by everyone about how the disease is transmitted and how to prevent mosquito bites. And this is just good public health, good common public health. And until people understand that they have to assume responsibility for this on their own, protect themselves using repellents, long sleeves, long pants, making sure that they stay away from areas where they could be bit by mosquitoes if they're pregnant. This is the most important tool that we have, knowledge and information. Vector control has always been a difficult game. It's always been very difficult, and that's why the Emergency Committee recommended that there be intensified research on vector control. Again, even though it's been recognized in the past, it's been emphasized again. And this includes many new and innovative ways of controlling vectors that might, in the end, prove to be feasible. So that was the answer that I had on vector control. Maybe you could add something on vector control in Colombia, Peter?
Yeah. Thanks, David. So on vector control, nothing really much to add, except that both in the US and Singapore, and I believe other countries are now considering novel techniques such as ultra-low volume spraying of insecticide. And so it will be very important to be able to evaluate those new techniques so that we can add to the evidence base on the different kinds of vector control strategies. But really, to underscore David's point, this is one element of prevention and only one element. In terms of Colombia, I don't have a great deal to add, except that you're quite right in pointing out that the number of cases of microcephaly in Colombia that have been confirmed is still relatively low. And we don't know if that's related to the fact that the outbreak started a lot later there than in Brazil, or again, if it's partly due to this cofactor question that remains outstanding. So we will need to wait a bit longer to get the data and see what that shows over the course of the next few months.
Our next question is, yes, yeah, we got it. Our next question is from Jamie Keaton from AP. And then we'll take one from the phone.
Thank you, Dr. Salam. I appreciate that. My question, I have two questions. The first sort of follows up on the flip side of Marta's question, which is what evidence or what makes, do you have any better understanding as to why we're seeing so many more cases in Brazil as opposed to other places? I mean, have you got any elucidation on that? Is there something else going on that could be affecting that? And then the second question has to do with, I'd like to go back to comments that you both made independently. You mentioned this real question of whether there's a link between the African strain and cases of microcephaly. What evidence, you suggested, Dr. Heyman, that maybe there is some evidence of that link, or is it just coincidental at the moment that for example, in Guinea-Bissau, that we're seeing both Zika and microcephaly? If you could just tell us whatever you know on that to answer that question that you've asked. In a way.
Our second question is from the phone. Sandy Lamart, please go ahead.
Hi there. I have two questions. One, it appears that Cuba has been amazingly successful in its war on the Zika virus, perhaps more so than other countries. And have you had any input from Cuba, or what is your opinion on their fight against the disease? And also, I'd like more clarity on the cofactor issue, please. Are you speaking of cofactors in terms of other diseases such as dengue? Are you looking at nutrition issues? What are some of the cofactors that you're investigating? Thank you.
So maybe on the Guinea-Bissau question, what we know is that there have been 4 confirmed cases of Zika virus, and the virology suggests the African lineage. In fact, the microcephaly cases in Guinea-Bissau were detected even earlier than the Zika virus. Now, we are still working with the government and WHO and partners to really assess whether that was just a reporting bias or whether really these cases of microcephaly, and there's 5, I believe, in total, were epidemiologically connected to the Zika virus infection. So that work is ongoing. So at the moment, we don't know the answer, but as soon as we know, we'll certainly release that information. David, do you want to comment on the other?
The other issue was the Cuba success, and I'm afraid that we were not briefed by Cuba yesterday at the meeting, so we don't have any information from the emergency committee, and I don't believe WHO yet has information. It's possible that PAHO, the regional office for WHO in the Americas, has some information, and they will certainly share it with us. The linkage, I just go back to one more thing about Africa. It's not even known, as Peter said, how large outbreaks have been in the past of Zika virus in humans, because they've not been detected. They've not come on the surveillance screen or the radar screen as something which has been unusual in Africa. At least they have never been reported as outbreaks. And if you remember, the first case of Zika was identified in monkeys. It had nothing to do with human infections. This was in Uganda. And it took about 10 years until the first outbreak was found over in Nigeria. So, in humans. So, it's just not known, but circumstantial evidence, because Africa has never reported these as being a cluster of something unusual, that they've not recognized it if it's occurring or it isn't occurring, one of the two. But there's lots of work to be done in Africa, clearly, and that's, I think, why the committee was being very cautious in what they said about countries, to help these countries understand what their real risk is. And that's a very clear activity for WHO and its partners to be working with those countries, and hopefully that will occur with appropriate resources behind it.
Either of you wish to comment on the question of why there are more cases in Brazil, or what kinds of cofactors are being explored?
Well, the cofactors, you've given a good list of some, and there are certainly, it could be all the way from genetic or nutritional factors that involve the individual, to environmental contaminants, to other co-infections. So there are a whole range of cofactors which must be eliminated if you're going to be able to say for sure with certainty that there is no cofactor. So it's a very, as you can see, a very broad and complicated research matter, and this is the type of research that is going on in northern Brazil. Then there's also the possibility, and I'm sure Peter will talk more about this, about just the fact that there's now increased concern, and so people are looking harder. But clearly, Brazil has had a major increase in microcephaly based on what they had from baselines in the past. But Peter will be able to say more, I'm sure.
I don't have anything to add. I mean, it is a large number of cases in the northeast of Brazil, and again, we need to understand over time, is this partly a factor of a time lag between when the infection hits a country and when we start documenting the cases of complications, or is this truly something to do with significant cofactors? And as David has outlined, those cofactors could be other diseases, they could be cofactors intrinsic to the population themselves.
So I think we may have time for another question. We don't have anyone in the queue, so we'll give everyone a chance, one last chance to dial 01 if they'd like to ask the last question. As we're waiting, just want to note to everyone that directly following the conference, we will send to the media list a link to audio files that are broadcast quality of the press conference that's just concluded. In addition, video excerpts will be available for TV broadcast if anyone would like to contact the WHO media staff. Later today or early tomorrow, we will post a transcript of today's session. And again, if you would like to ask a question, please dial 01. And we now have 2 questions, and these will be the end for our press conference. May I call upon Tom Clark, please, on the phone?
Oh, hi there. Yes, it's Tom Clark here from Channel 4 News in London. Thanks for taking my question. There has been some speculation that there has been, as awareness of Zika virus has expanded, that women have had more access to terminations of pregnancies early in the trimester that could account for the difference in microcephaly cases outside of Brazil, where there wasn't awareness nor access to access to terminations. Has that factored in your discussions? Is it seen as a potential explanation for some of the differences in the number of microcephaly cases?
And the second question is a follow-up from Helen Branswell. Please go ahead.
Thanks. At one point in time, WHO said that it had learned that Colombia was not reporting microcephaly cases if the baby wasn't born live, that if there was a termination or a fetus was lost before birth and it evidently had microcephaly, that they weren't counting those as cases of microcephaly. Have you had reassurances from them that they're now counting in the same way as other countries are? And if I said Brazil, I mean Colombia.
On the first question, obviously it's not an easy issue to get hard data on, so it's really not a question we can answer definitively. We have heard the same speculation. It wasn't a major topic of discussion at the emergency committee meeting yesterday. But the WHO position is that we support women to have the range of information and the range of contraception that should be available to them to make their own informed decision, of course in accordance with national laws. So that's really the position of WHO on that issue. In regards to Colombia and all countries, yes, we are working on really standardizing the case definitions and the reporting, and we have had some assurances that that's the case.
No, thank you.
All right. I'd like to thank our spokespersons and the journalists and others for joining us for today's press conference by phone, Facebook, Periscope, and in the room. Please check the WHO website for postings of the media statement and links to other resources. Thanks again. Goodbye.